Hello, welcome everybody. Welcome to the Return to Practice webinar run by the Royal College of Occupational Therapists with the HCPC and Health Education England. So my name is Anne Keane and I'm the Professional Practice Enquiries Service Manager. Just to let you know that this webinar is going to be recorded, and also just to so you're not doing too much scribbling, you'll be sent slides off this as well. You're very, very welcome, and we're very, very excited to deliver this webinar. Okay, so what we're going to do, so as I said, this is being run in collaboration with Health and Care Professions Council, which, as you know, that's the body that you need to re-register with in order to return to practice. And also Health Education England have funded a project in RCOT, and they've funded these webinars as well. But just to put your mind at rest, so if you are from any of the other 3 nations, the information that we will give and the information from the college and HCPC, that's for across the 4 nations. So what we're going to do, I'm going to introduce you in a minute to our speakers. We've got a question and answer function that you should be able to see on your screen. So if you've got any questions, anything that comes to mind during the webinar, if you just please pop your question in the question and answer section. And then when we get to near the end of the webinar, I'll go through the questions and we'll answer them between us as well. And also, like I said, it's being recorded, so you can just listen and just not to worry about making too many notes, etc. And one thing I wanted to say at the start is that it can seem, I'm sure, really overwhelming at times with thinking about what you need to do to return to practice or what you are doing. But just wanted to try and reassure you as much as possible that you're not on your own with it, that we will help you, we will support you. And I lead on return to practice, so I can meet with any of you and go through your own individual situations. So don't worry, and don't feel too pressurized by it. Okay, what I'm going to do now is to do our introductions. So, like I said, I'm Anne Keane and I lead on return to practice for the college. I'm just going to go down my screen, so introduce you to my colleagues. So we've got Alice.
Hello, I'm Alice Ford-Smith and I'm the librarian at the RCOT Library for Collections and Access.
Brilliant. And we've got Roxanne.
Hi, I'm an occupational therapist and I'm going to be talking about my return to practice journey.
Rachel.
I'm Rachel Harrison. I'd love to say I'm an occupational therapist, but I'm not quite yet. I'm currently carrying out my return to practice internship with Anne and the professional practice team at the Royal College of OT.
Thank you. Natasha?
My name's Natasha Pazarski. Good evening, everybody, and I'm the National Programme Manager for the Return to Practice programme here at Health Education England for those looking to return to the HCPC register.
Thank you. Lorna?
Yes, hello everyone. My name's Lorna Rutherford. I'm the Library and Information Services Manager at the RCOT.
Brilliant, thank you. And last but not least, Kim.
Hi, my name is Kim Tully. I'm a professional liaison consultant at the Health and Care Professionals Council. Thanks ever so much for inviting me, Anne.
No problem. Okay. So just to check that you're fitting in the right webinar. So this is for people who wish to return to practice as an occupational therapist. I want to re-register with the HCPC. And it doesn't matter whether you're in the middle of that journey or you're thinking about doing it, starting it tomorrow or next year. It doesn't matter. This is just an introduction, to the subject and to let you know what you would need to do and what support is there. So, like I said, you're all very welcome, and we just hope to give you some confidence and to inspire you and to let you know that we will support you in your journey. Okay, so we've got quite a lot to get through. So forgive me for the number of slides, but we will get through everything. So we're going to look at what does returning to practice involve? What do you need to do? What status can you have as a returner? As in, can it be voluntary? Can you do it as a support worker, etc.? We'll look at who can provide supervision and what level of supervision returners need. Then a really exciting bit, we've got personal stories from Rachel and Roxanne. Then I've got some information on resources and then where to go for advice and support. Okay, so I'm firstly going to turn to Kim, who's going to talk about how to return to practice regarding the HCPC regulations.
Thanks, Anne. And I think this is the bit that people are very, very worried about, is actually their registration. So I know that Natasha and Rachel are going to talk a little bit later about their journey and the support that's on offer. But the end of that journey is about getting your registration or re-registering with the Health and Care Professionals Council. So I want to thank you for actually starting this journey or being on the journey, because I think it's really exciting. And I think that, you know, it's any journey that we start is quite tough, and we at the HCPC want to make it as fair but also as flexible as possible. So we've spent quite a lot of time, my colleagues have spent quite a lot of time devising what you need to do to re-register with the HCPC. So next slide, Anne, if you like, and I'll go through that if that's okay. We've got some really good guidance. It's called Information About Our Requirements for Professionals Returning to Practice. And really what the guidance is all about, it's got to be undertaken in return to practice if you've been out of practice for more than 2 years. And of course, breaks occur for many reasons in our lives. And that's just some of the reasons that we know that breaks actually happen. And the next slide, please, Anne. So in our guidance, there's this lovely flow chart, and I think it's really useful. You have what I tend to do is print off important things like this and sort of highlight bits that are important for me. But it's got some really good information there that talks exactly what you've got to do to re-register with us. So I'm not going to dwell on it because I'm actually going to move through the next slide, Anne, if that's okay, because there's a certain amount of things that you actually need to do. So if you've been out of practice for more than 2 years, you'll need, between 2 and 5 years, you'll need to do 30 days of updating. If it's 5 years or more, it's 60 days. And there are 3 elements to that updating. And I know that these are going to get talked about later on, but for the first one is supervised practice. So literally you've got to be practicing under the supervision of a registered professional. You've got to do some formal study. So it might be distance learning, e-learning, it might be return to practice programme, continuing professional development, or any module that's sort of run by an education institution. So we're very flexible about that. And there's private study as well. Now, private study shouldn't take more than half of the period that you've actually got to complete, okay? But that's things like using the library at the Royal College of Occupational Therapists, accessing websites, books and journals, but it also could be time shadowing or observing another healthcare professional. Next slide, please, Anne, that's lovely. So your responsibilities, you've got to be responsible for your own period of updating and making sure that you meet the standards of proficiency before you return. But I think this webinar really shows the amount of people that are on your side and the amount of people that are prepared to walk that journey with you, because there is support, there is a lot of support. Not only at the HCPC, there's a phone number that you can call from one of my colleagues, but Health Education England, the Royal College of Occupational Therapists, we're all here to be with you and to support you, because it's so important that registrants such as yourself come back to practice. Your employer has responsibilities as well, and they might set their own requirements, and they'll also assess you for the post once you've got your registration, of course, and there'll be a period of induction or mentoring. Next slide, please, Anne.
Well, next we've got Natasha, who's going to do her presentation, and a little bit later, Kim's going to have some really useful guidance about the paperwork that you need to complete when you're actually going back on the register. So hand over to Natasha now.
Thank you very much, Anne. So next slide, please. So I just thought I'd start by just talking a bit about who Health Education England are. So Health Education England is an arm's length body, and we are part of the NHS. Health Education England works with partners to plan, recruit, educate and train the health workforce. And it exists for one reason only: to support the delivery of excellent healthcare and improve health and health improvement to the patients and public of England by ensuring that the workforce of today and tomorrow has the right numbers and skill mix and values and behaviours at the right time and in the right place. We support doctors, nurses, allied health professions and other professions, including non-registered practitioners as well. And this Health Education England Return to Practice programme exists to support returners regain their HCPC registration. Next slide, please. So you are in good company if you're thinking about returning as an occupational therapist. As Occupational therapists are one of the largest returning groups that we support as a profession. Currently, we have at least 135 OTs started on the programme, and 32 have completed their return so far just this year. Over the life of the programme, we've returned 204 occupational therapists since it began in 2017. Next slide, please. So a little bit more about the requirements. As Kim said, the HCPC return to practice requirements are very flexible and allow you to update your skills and knowledge within their parameters in a way that works for you and is meaningful for you. It is a self-directed process, and it involves, as Kim said, formal study, private study, and or supervised practice to update your knowledge and skills. The returner has 24 months to return to the register as well. I think that's really important to flag up to people listening. It used to be 12 months before COVID, and this was extended by the HCPC to 24 months. But we do find that most returners return much more quickly than this. But just to make you aware, it is a self-directed process. You go and get your own pace. You do have that 24 month window to collect all your evidence prior to applying to rejoin the register. And your competency is assessed by the HCPC. So obviously the HCPC set out the criteria, and we have a programme of support to offer you any resources or signposting, or to pick up the phone to you during your return to help support and guide you along that journey, really. Next slide, please. So I've just put this slide in just to show you, how we sort of pitch return to practice to organisations that might be looking to support you. So, we know that the average age of a returner is around 44, and that on average they're bringing back 9 years of experience when they're returning. That's a massive win for an organisation to get you back in with all those years of experience. So you're a really valuable asset returning to the workforce. And we know that around 60% leave at band 7 or above as well. So you're leaving with an awful lot of skills that you can return and knowledge that you can return back into the workplace. So we really do emphasise that when talking to organisations. And not only that, but you bring a lot of transferable skills back with you back into the workplace, and general life experiences and life skills as well that you can utilise it in your roles. So please don't undersell the transferable skills that you will bring back in with you as well. And it is a relatively quick and cheap way to bring back staff into the workplace, because we know to return a returner, it doesn't actually cost too much. It costs around £1,175, and when you compare that to training an occupational therapist from scratch, then it is a really quick win for the NHS and social care and non-for-profit organisations, generally, and of course education. So we at HEE, if a returner undertakes a supervised practice placement, we offer £500 to eligible organisations for supporting you, to help them with costs such as like the DBS, for example, or setting up contracts, and also to help them cover the costs of you maybe needing to travel between sites during your placement, so that you can be reimbursed. Or some of those costs are passed on to you as the returner when you embark on a supervised practice placement as well. Next slide, please. So I know we've got a couple of returners on this event this evening, which is fabulous to hear it firsthand. But we do also have on our Return to Practice website some case studies that you might like to go and read, to see how others have gone about their return to practice journey. There's some lovely postcards we've produced recently with some case studies on, and some more sort of where are they now case studies following that returner up from when they went through the process and where they're now working as well, to give you the full story. We've also got an awful lot of information on our website should you wish to find out more about the programme of support available. And if you are not already signed up to the programme but thinking about it, you can inquire now on our website as well to join the programme. We do have a SharePoint site that we've recently launched, which is a national SharePoint site. There are 2 sites. One is for returners that are registered on the programme. There's a wealth of resources about how to get started with your return. Things about, we have things around like private study, so recommendations from other returners, for example, about as an occupational therapist where you might want to go to find some really good private study resources, formal study courses that others have recommended. We advertise a lot of news and events on there that we're running, and there's a database on there of return to practice contacts for you as well, in terms of supervised practice placements. So if you're looking to connect with an organisation, you need a name and an email address to help you do that, then there's an awful lot of information on that database that can help you as well. Next slide, please. So the funding that's available via the programme to support returners is there's £800 claimable by yourself for out-of-pocket expenses, and these might be things like covering childcare costs to allow you to attend a placement or a formal course, or it might be that you need to travel to placement, so you can recover your mileage costs for travelling to placement, for example. Ordering textbooks, you know, those sort of things you can claim back rather through your expenses. So what you do is you pay out for whatever it is. First of all, you get the receipt, and then you, through a Serenity claim system, submit the receipt alongside your expense, and we reimburse you for it. And then the £500 that's claimable by the organisation can either be done via invoice, or for NHS organisations via the educational contract as well. Next slide, please. So why should you join the programme? I've mentioned obviously about the funding that we offer. We are regularly picking up the phone or answering emails to offer support and guidance to our returners as well. We offer you linkages around supervised practice placements, either through putting you in direct contact with professionals in your region that may be able to connect you up, or via the database that we have on our SharePoint site. We offer access to e-learning for health modules as well, and discount on Royal Society of Medicine courses. We've got a closed Facebook group for peer support with, I think it's close to 900 members on it now, and we do feel that's a really positive closed space for returners to ask those questions that they perhaps don't want to ask in an open kind of social media environment. So I personally think the Facebook group is a real success that's come from the programme, because it really offers that kind of, you know, peer-to-peer support, which is great to see. We've also recently commissioned a personal development programme to offer some small virtual group support for returners as they progress along their return journey. And the idea of that is to help returners with their confidence in their ability to return, address some of the issues that returners often say they suffer with, things like imposter syndrome, feeling like, you know, they haven't got this, that they don't feel that they quite got it to return, and we help them to address those kind of confidence issues and help them to realize that, you know, they're a really valuable professional that actually just isn't registered yet, and we want to support them to get back on the register. We also, as part of that programme, do a reintroduction to the NHS and care systems to help you understand the NHS and care system as it is now compared to perhaps when you might have left. We also offer a HR session with a HR specialist as part of that programme as well. So the other things that we have recently commissioned is with Birmingham City University and Coventry University. We have virtual return to practice programmes as well. These are open to occupational therapists and enable you to complete all of your return to practice hours as part of these programmes should you wish to. Obviously, being part of the programme as well enables the national programme to report the numbers of HCPC registrants that are returning to the register by the support of the programme. And I love this quote from Mark, a diagnostic radiographer that returned with support of the programme. And just in case anybody sat there thinking, gosh, I've been out of practice for so long, though I don't know if I've left it too late to return. And, you know, Mark returned after 29 years and says, you know, you should definitely give it a go. It's never too late to get back into the workplace, and he's proof of that. So I really like that from Mark. So I would really encourage people to return however long they've been out of practice if they're really motivated to do so. Next slide, please. So just wanted to finish up by just giving you a bit of practical information about where you might want to start if you're thinking about signing up to your return to practice journey. So you can visit our website, click on the Inquire Now tile and complete the inquiry form. I say wait up to 10 days because it's mainly me that does it, and just in case I take a holiday occasionally, but it's usually a matter of 2 to 3 working days. You'll get a email come into your inbox, and do check your junk because sometimes they do end up in there. It comes from JISC Online Surveys actually, and you need to complete this survey. Again, wait 2 or 3 days, and then we'll send you a welcome email welcoming you to the programme and inviting you to join our SharePoint platform with all the resources to get you started, and obviously offering any other assistance that you might need from the get-go. Next slide, please. So that's me. There's our generic email there, our return to practice inbox. If you do have any questions following this event and you want to follow them up with us, then please do drop us an email. We're very happy to receive inquiries from you about the programme, or if you are on our programme and you're grappling with something at the moment, please do reach out to us, as obviously if you don't contact us, we don't always know that you're struggling. And the website there on the screen, if anybody wants to take a look at that as well. Thank you.
Brilliant. Thanks, Natasha. That was really good. Now we're going to hand over to Rachel. So Rachel is in the middle, or towards the end actually, of her return to practice journey. So are you there, Rachel?
I am. I'm here. Thank you, Anne. Next slide, please. Right, a little bit about me then. I had a wry smile, some of you may well have noticed, when Natasha mentioned imposter syndrome. I can relate a lot to that. I qualified back in 1992 as an occupational therapist and started full-time work the same year. Throughout my career, I worked as a basic grade, senior 2, as they were known back in the day, senior 1, lead OT, education and therapy lead, and I was head of profession. And we had about 150 OT personnel when I was in that role. I was promoted to some non-OT specific roles. So I was a hospital director for a period of time, and I was also a service director as well, and managed heads of professions from other allied healthcare professions. Some would say I was too focused on my career, as I didn't actually get married until I was in my very late 30s. I had our first child and then returned full-time as a service director, and then had another child at the ripe old age of 42. So I was classed as a geriatric mother. Next slide, please, Anne. Following the birth of our second child, I was made redundant, and at that stage I decided to take a career break, as I say, because really work had been everything for me. And then obviously with having a young family, I kind of decided just to push the reset button for a while. And I think with being made redundant, it helped my decision in some respects to do that. So I came off the HCPC register back in 2018. My initial plan was to return to work in 2020, but due to some short-term health challenges that have subsequently resolved, my career break lasted a little bit longer than I intended. So during that time, I really looked at I knew I wanted to return to practice, but it was a case of what do I need to do to get ready to return? So my first port of call was reading all of the HCPC requirements on return to practice. And I think initially it can seem a little bit overwhelming, and that's certainly how I felt. And I'd look and I'd go away and I'd go back and look and then go away. And I think the hardest decision, certainly in my experience and through talking to others, is actually making that decision to return. I was clear from the information that I read that I needed to do a minimum of 30 days of practice. And as has already been referenced, that needed to be a combination of both supervised practice, formal study and private study. Next slide, please, Anne.
Thank you.
So if we're to fast forward to 2022, that was really when my decision to return to practice took off. But the challenge that I had, and I've heard others have experienced this too, was identifying a suitable supervised placement. But I very quickly learned that there's so much support out there to find what that solution can be. So as Natasha has already mentioned, Health Education England and the return to practice courses was one of the areas that I considered. I also made the decision to rejoin the Royal College of OT, and that assisted my focus. I sat down and thought about my learning needs. And again, as has already been mentioned, it's so important to consider all of the things that you've learnt during the period of time that you've been off the register as well. And then, as I frequently say, the stars aligned. And I saw a tweet from the Royal College of Occupational Therapy that was offering a 20-day return to practice placement with the professional practice team, so with Anne's team, and this was funded by Health Education England. I applied. If I'm really honest, I hope that lots of other people wouldn't see the same tweet. I was hoping there'd be less competition. But nevertheless, I applied, I was interviewed, and I was offered the internship and started with the Royal College back in November. And I have to say, the experience has been absolutely amazing. And as I wrote the presentation, it was day 14 of the internship. Today, I reached day 20 of the internship. So I will have completed, as I say, 20 days of supervised practice by now, which is just amazing. I've found it really refreshing, the whole process of invigorating my skill set. But I've needed to remind myself, as I mentioned earlier, not to lose sight of what I already knew, because it can feel overwhelming at times. And my aim is to apply to rejoin the HCPC register next month, and that's certainly realistic. So my advice to you as a returning practitioner would be really to decide, do you actually want to return? Because as I say, I think that is the hardest decision. And then very much review all of the HCPC information on returning to practice and really determine how many days of practice you need to do, whether it's 0, 30 or 60. Review the Royal College website and refer to the Return to Practice Returner Handbook. There's a plethora of information that's on there. And contact HE and find out what's available to support you in your home nation, and perhaps consider the distance learning course at a university. And then just sit down and think about what your learning needs are, because as Kim and others have said so far, the whole process is flexible and it's centered around you and what you need, and just go for it. Because it really is amazing. I mean, I'm so passionate as an individual, which I hope has come across this evening. I love my job. I've loved being a stay-at-home mum. But there's only so many episodes of In the Night Garden you can watch. This has been so invigorating, the whole journey. And as I say, I look towards Roxanne with admiration and a little bit of green-eyed monster envy, if I'm honest, because she's got there and she's done it, and I raise my hat off to her, because it is a journey. But yeah, just go for it. Please do. Thank you.
That's fantastic. Thanks, Rachel. So now we're going to hand over to Roxanne, who's been there, done that, and she's returned to practice, and she's going to talk a little bit about her journey.
Right. Yeah. So yes, I've completed it in a sense. So my return to practice journey, it probably started, I think, about six years ago. Next slide, sorry. And so I qualified in 1998, and I did my what was known rotational basic grade post in the acute hospital, and then I went into rehab, where I did senior 2 posts, and senior 1 post, which is also band 6, would be band 6 posts now, and that was predominantly in inpatient and community neuro and rehab teams. And then I then became in one of the stroke units I was in. I became an acting head of the stroke unit and the acute care of the elderly, because the current team lead, she was off on long-term sick. I actually did the opposite. I had got married straight after university, because I've been in uni, so we'd been together in uni. So yeah, that was it. She got married. So, and when my role then had to come to an end, my husband had got a sort of a job abroad, and that was kind of the start of my career break. So rather than thinking, okay, was I going to do locum? I did locum for a little bit, and then I thought, oh, you know what, right, okay, we'll do this journey abroad. I obviously fell pregnant, returned back to England to have my daughter, and then we moved to Scotland, because that's where I am. So I'm in Scotland. I do love OT. That's what Rachel was saying. As I'm saying, I love OT, and I did want to at some point return. So I was kind of like I was looking at it, and then I fell pregnant. I had my son. So my career break got extended again. So when you sort of started nursery, I started thinking about it again. And it is when you actually do that first point of actually thinking about it, it can seem really overwhelming. I wouldn't lie about that at all. It can be like, oh, I've been out of this for so long. What do I have to do, and where do I start? One of the first things I did do is rejoin RCOT, and that was really good, because that was where I got a lot of the support, all your resources, contacting them with emails about advice and support, and about me wanting to return to practice. And I was umming and ahhing a lot. They then had, because this is before COVID, so they had a return to practice study day in the college, which was great, because I met people, and I met a good friend that we then shared that kind of support to encourage each other with our journey. She completed her journey before me, and I know that feels very jealous. Then I was thinking, oh, I've got to get there. I will get there. That's the thing. You have to keep kind of like telling yourself. But I tell you what, with me in Scotland, it was like, where do I start? How do I find a placement and all that? And again, it was the college actually looking at, they then helped me again by finding out who was the professional team lead and all that. But I think, again, I agree with Rachel, it's very important. Research what your requirement is going to be, so how long you've been off. So mine was a long career break, so I had the maximum of 60 days. And I'll be honest, that did look like, oh my word, can I do 60 days? But actually, when you look at it and you think, right, how you break it up. So your 30 days is the supervised, that's it for your supervised stuff, but that can also be done, if you've got a formal training, formal course that you can actually. So I actually did an open university course that was literally record keeping, which was excellent, because it was, for me, that's a little bit of confidence, because that is something that's really important when you go back into OT, is your record keeping. And obviously legislations and everything and all that kind of thing has changed. So again, I thought that was really important. So as I said, mine was the 60 days, but as I said, you break it up, as I said before. And my sort of, as I said, your non-supervised days, it was because, you know, I had like, you know, doing your private study, you know, reading articles, critical and I'm not going to say that word, but you know what I mean, and all that kind of that kind of stuff that you can do as your private study. As I said, it was a challenge to get a placement, because I needed for that supervised hours, and the college did help me. So the professional team lead, who's still my professional team lead, but for our board, because it goes by counties in Scotland, she then contacted me, and she was very supportive in the sense that it can be done, and you know, and then she sort of give me a way that, look, and then after you've done this, you just go on the bank, and again you'll continue with the support on the bank. She then so obviously mine was all self-funded in Scotland, and you know, and self-directed. I was assigned a supervisor who was, honestly, she was excellent, and I think that is really, really important, that you do get a supervisor that is there not to make you feel, oh my goodness, she's watching everything I'm doing and what I'm doing wrong. It was because she said, you know, her main goals was that she wanted to be really supportive for my return to practice, and her goal was to build up my confidence, to ensure I was aware of the best practice, you know, doing things like clinical reasoning. I was shadowing. She'd arranged, or I shadowed all the different areas of OT and updated my OT skills and knowledge. And it was really good because I also created a chart, and I think this is actually just a really good thing to do. I did it on Excel, so as you put your hours in, or you know, it'll you know, update it, and actually seeing it increasing as you're going along. That's honestly, that was the best I did. It was my husband's advice, so I actually did it because he's very good with all the. And that is honestly a good thing, because you see, because when you're just doing it and you're not actually thinking, is my hours increased? Oh my goodness, how much more have I got to do? When you see that when you see that on your computer, and you think, and the hours change, like, you know, oh, that's it, you know, 5 more days to go, or 10, you know, it does really, really give you that little boost to keep going, literally, when you are starting to feel as, oh, can I do this? It's really, I would advise that, and literally, and I think especially for when you've got to do your HCPC registration, is, you know, anything that you've been doing for private study, you know, if you've read an article, that all goes towards it, and you don't realize that could be you sitting for an hour reading an article out of the journal, that you then go back and you critique it, you read it. That is private study, and that is actually going towards your time. So it will start to come down when you're doing all those kind of things. So just sort of say, I mean, I did things like, because obviously my area was, I wanted to go back with neuro and stroke. So I actually got a rehab assistant post within a rehab team, where my supervisor was based. And this was really, really good. And this was because I could now carry a small caseload. Sometimes they were naughty, because it would be like, go to ask Roxanne for advice, because, you know, she's qualified OT. Like, I'm here on my supervised placement. I'm doing my hours, my registration hours. Because like sometimes you get the bad vibes, and I might give a bit of advice, but remember. But it was really good in the sense of you build that confidence, because you're carrying that little caseload with the support of your supervisor. And you know, that again can make you start to feel, well, I'm practicing, I can do this one, I can actually be able to eventually practice. And you know, and also you start working with other health professionals, and I was with sort of the district nurses, speech therapists, physios, back in that, especially when you're with the physios, because that's really you. And you really start to feel, when you start talking, I know what they're talking about. I understand that. Yes, that's a good, yes. And it all does start to come back. And actually, in a way, my registration happened a lot quicker than I anticipated, because of in that post, but because of what I was actually doing. So then I registered, yes, hey, and I went straight onto the bank as a band 5 within my local health board, and I went yes, I know it says, oh, you know, I didn't go back, but that's band 7 or high. I think it's, I mean, not everybody would like to do it, but I think it's a really good idea to start at that band 5, just when you're just as you're going back, because you will still get that support. You will still get all that building your confidence. You've got your continued regular supervision until you really feel confident. So once I then started to feel a bit more confident, and my sort of professional lead, she's like, right, that's it. You can be a band 6 now. And I'm like, oh, can I? She's like, yes, you can. And I did. And I then worked in sort of again on the bank, a variety of community rehab teams, because that's really where I wanted to go back to, and building all that kind of updating my skills, my knowledge, and all that is so important. You can do that, and you can do that while you're on the bank. And I think also the bank is good because it does help you with adapting, so you are ready. It's that sort of thing. You're right. You can go into the role, and if you can go into all these different places and just get on with the work, you're ready to do it. So my eventually role came up that I really wanted, and so now I am 2 years plus in a community rehab team, with my specialism being neuro and stroke. And just as a final note, I've got on there, OT is still OT, and I say that because it may seem really daunting and challenging, and believe me, honestly, I was really anxious at the beginning due to my long career break, and there were days where you do have your up and down days, but honestly, it does come back to you, and the more you submerge yourself back into OT, your confidence just grows. And I say you can do it. That's me.
Thanks, Roxanne. That's brilliant. You're really inspirational. Thank you. So now I'm going to hand back over to Kim, who's going to talk about the paperwork that you need to complete in order to return to the register. Thanks, Kim. Thanks,
Sam. I think first of all, can I say a massive thank you to Rachel and Roxanne? I know that you're going to later on, but I just kept thinking, oh, I'm going to follow that. Those two inspiring ladies. I was quite transfixed and inspired by your stories about the determination, resilience, but massively what came across as your enthusiasm for wanting to be an OT, which I think was very inspiring. You should feel both very proud, very, very proud. So I'm going to follow that. I'm going to talk about the logistics of how you do it. And I know Roxanne's been there and she's already talked about it. And I love that idea of a spreadsheet with ticking off the hours. I think it's a really good idea. So the first thing, there's sort of key parts, and we just thought it was useful to just go through the top tips. So I'm just going to go through some top tips. These are on the website. These are in the documents that I signpost you to. One of the important things is to make sure that your counter signatory, the person who signs the cover sheet, is an OT, is registered with the HCPC, and we might check that. So just to say that. So Anne, just if you could have the next slide, that'd be lovely. Thank you. You have to do a supervised practice form, which I know that Rachel and Roxanne have talked about the hours that they've done. But again, the supervisor has to be the same profession with you as you, and has to be registered on the HCPC register for at least 3 years. Now, that person shouldn't have been subject to any fitness to practice concerns, and that goes without saying, really. That's the important bits about the supervised practice form. Thanks, Anne. I know you're having problems with your computer, you poor thing. There is a private study form, and I love, again, Roxanne's sort of ideas of completing and reading journal articles. You can use online information. It should only, I've already said this, it should only be half of your updating period, and that's fairly straightforward, isn't it? And you just have to specify on that form what you've been doing and how many hours you've been doing. It's very straightforward. We try and make the form really, really straightforward, because it's not our responsibility at the HCPC. You've had a supervisor who's signed things off. We're checking the form, really. Okay. And the next and last one, I think, is a formal study form, which tells us the number of days that you've done. And it's not the number of hours. I know our team at the HCPC have said to me, just mention, could people just put the number of days, not the number of hours? It just makes it really clear for the team when they're looking for it, okay, going through the information. And we've already talked about all the things that could include, and again, we try and be as flexible as we can. One more slide, I think, Anne. So we check you've done the right hours, We might contact you or the organisations or individuals, so don't be worried if we do. We look at our register to check your supervisor, and we check that the supervisor doesn't have any fitness to practice concerns. And we might also contact the organisation that provides a formal study. It's just about doing the checks really, and making sure that, as you'd expect, the Health and Care Professionals Council does the checks. So it's very, it's almost like, what I would align it to is doing one of those awful jobs that we have to do, like your car insurance or your filling out a new bank account form. It's a horrible thing to have to do. We all hate those sort of administrative tasks, but this is the administrative task behind all the things you've done before that. So like Roxanne and Rachel talked about, you've been doing an awful lot, and then it's about completing the form to evidence that. That's the important bit. So there we go, and thanks ever so much. Thanks.
Brilliant. Thanks, Kim. Right, we're getting towards the end of the actual presentation. I'm going to talk a little bit about the Health Education England project at RCOT. So hopefully in March, I've said that now, so we have looked at our Royal College of Occupational Therapists website, the Return to Practice web pages. They're all going to be updated. We have got 3 new resources that have been written for returners, and this covers all 4 nations of the UK. So we've got a guide for the returner, a guide for the supervisor, and then a guide for the employer stroke placement provider. And something that I really try hard to promote is that with our members, with our occupational therapists who are already on the register, is how important it is to provide a supervised practice placement for our colleagues and to give people the opportunity to do a placement, because there's a lot of kind of myths that go on out there about people think they have to judge competencies or somebody's fitness to practice, and they don't. So I'm hoping these guides will help to do some of that myth busting as well. And I know that obviously HCPC and HEE obviously have really good guidance about this as well. But I'm hoping that these guides that are going to be on our website will help to do some of that myth busting. So HEE, so they funded all of this. So they funded the money for the new resources. They funded these 2 webinars, which are really grateful, and they've funded our Rachel to do her internship at RCOT, which is brilliant. So I'm going to talk a little bit now about guidance and support from RCOT. And what I'm going to do in a minute, sorry, just to say, I'll go back to the library in a minute, is that if you're not a member of the college at the moment, you can still access on our website return to practice information. But then if you do become a member and you can become a career break member, I've got some information about that in a minute, then it's cheaper than joining as a full professional member. And then you can access absolutely everything on the website, and that will help you with your private study and also some formal study. So first of all, I'm going to hand over to Lorna from our library, who will go through some information about how you can use the library and the RCOT resources to help you with your private study.
Yes, hello again. On the slide, you'll see Alice and I work together, and through the library we provide online resources specific to and related to occupational therapy. So we're quite a tailored collection, and you just need to log into the RCOT website to access those. We understand that some of you here today may not be members. So in the follow-up from this session, Hannah will include some links to resources which are free for all. So how can we support you in your return to practice? Well, the resources that we provide are tailored, specific, and they're relevant to occupational therapy. Therefore, the results that you may get may be less overwhelming. Plus, they're all in one place. They're on our website. The resources and us as librarians as well can support your CPD, private study, learning, research and practice. So we're available for you at all stages of your occupational therapy career. And the resources that we provide, the e-resources, they're always available to you 24/7. So whenever and wherever you want to access those. They complement in some ways those online services and resources that you may already have through the NHS, through social services, or through a university. And also, we're a constant and familiar platform to you. If you're returning to practice, or if you're moving between employment, you begin working independently in social care or in the third sector, our resources might be some of the only ones affordable to you, and they are trusted resources that you have access to. So you'll have access, they're listed on the slide here, to ebooks, electronic dissertations and theses. You'll be able to access those through our library catalogue. And the catalogue also provides details of RCOT publications and electronic reports, that kind of what we call grey literature. Through our online databases, such as CINL and Medline, you'll be able to search for a topic, and there you'll be able to link out to the full text of journal articles. You'll also have access to our information skills guides and sheets, and these will help you hopefully to use our resources. You can always ring us or email us, and in fact with any query, we run an inquiry service, and the email is there on the slide. So at this particular point, logging into the website and having a browse, we heard several people talk earlier about confidence, and having a browse might be a way of dipping your toe into the water, having a look at an ebook when there's no pressure. Have a look, see what we've got, what might be of interest and help to you. Perhaps make a tea or coffee, put aside half an hour, put aside a quarter of an hour, put aside 5 minutes to just log in, have a browse and leave, and then go back and, you know, just perhaps play with the resources, see what catches your fancy. There might be something that you like or you're drawn to, and browsing the resources might raise a question. But at any point, do give us a call if you get stuck or overwhelmed, and we'll be there to help you. Thanks, Anne.
Fantastic. Thank you very much, Lorna. Right. So just going on a little bit about guidance and support from RCOT. So like I said, you'll get the slides following the webinar in a few days. So that's our current Return to Practice webpage. Then I've got information about the career break membership if you wish to join or rejoin RCOT. I've got the email address and the phone number for the Professional Practice Enquiries Service. That's the service that I manage. And then a link to our actual web pages, and they've got quite a few frequently asked questions on there as well. Okay, so kind of final thoughts from us before we go on to the questions. So as we said, we appreciate, and no one will appreciate this more than Roxanne and Rachel, that it can feel really overwhelming, but you can return to practice as an occupational therapist. You know, I've supported people who've been out 20 years plus, and it's often that initial, just that kind of initial deep breath, to have the confidence just to inquire and to find out what you need to do. And what's fantastic, as we said before, you know, by Kim and Natasha, etc., is that HCPC are very flexible. So it's very much, it's self-directed, and you can make it work to your, basically your lifestyle. So if you only get, you know, like I'm a working mum, you know, if you only get half an hour in the evening to do some reading or something, you can do that, and you can build up the time. And like Roxanne was saying about how she, you know, how she kept track of her hours, etc. So it's really flexible like that. Wanted to say as well that you may feel like you're on your own with it, but you're not, and we will support you. And many people are going through the journey at this time and have done it. An important thing to remember as well is that OT is OT. Like, I qualified as an occupational therapist in 1994, and I'm still going. And so the key to occupational therapy is still occupation. It's still person-centered. It's still us using our skills and helping people to engage in their occupations, as you know, and to help them try and improve their functioning in all areas. So you've got that running through the middle of you. You know that you've got that, and it's just a lot of it will be updating, you know, about policies and procedures and things that have happening in practice. So you've still got a lot of it there already there. And one thing, although it's very unfortunate from one sense, there are loads and loads and loads of vacancies. There's a huge shortage of occupational therapists and other professions, of course. And that's why returning to practice is something that we're all trying to promote, different agencies, and like Natasha was saying, to employers, just to say that, if you have difficulty filling posts, there are people sitting there waiting who want to return to work. They just need a bit of a hand to do their return to practice. So it's very likely that there are jobs available for you when you're there. Don't put so much pressure on yourself. It's easy for me to say that, but you can try not to think of it as the whole package. It's about doing a little bit at a time and making sure that you record your hours and your days, and you're keeping track of that. And the last thing I was going to say was good luck with it. I've got my contact information there. So you can either contact the Professional Practice Enquiries Service email address, or you can email me directly. And I'm more than happy to have a phone call with you or a Teams meeting just to have a chat about your situation, and we can go from there. Right, thank you so much. I'm going to stop sharing my screen, and I'm going to look together at the question and answers that have come in the chat box. Now it's 4 minutes to 8, but we are happy just to answer those questions, so we'll be as quick as we can. Okay, so I'm going to go through and read out the questions, if that's okay. So the first one's from Sarah. So do the return to practice days need to be completed within 1 year or 2 years prior to re-registration? So it is the 2 years, the 24 months that Natasha was talking about. And there are some places online it still says 1 year, but it's still definitely 24 months, the 2 years that you have to return to practice. So basically, the day that you send your form in, you would have to do all your returning in the preceding 2 years. Okay.
Totally agree, Anne.
Okay, thank you. The next question is Cindy asking about Scottish returners. What I can do so obviously the majority, so this webinar about Health Education England is for people, they can access the programme if they live and work in England. However, with the guides I've got, and I've got information about the other 3 nations and how we've got links and advice regarding that. So if you just contact me directly, I can go through with you what the process is in Scotland. And unfortunately, in the other 3 nations, there isn't a scheme like Health Education England, but there are still ways to do it in the other 3 nations, and I've got information on that. The next question, I'm from Wales, is about Wales. There is a similar return to practice programme in Wales, and again, I can do the same thing. So if you contact me separately, we can go through that with you, not a problem. Then another one, can you join RCOT before you start the return to practice? Yes. So it would be as a career break membership is the membership that people generally would join, which I think is about £16 a month. But again, if you just contact me separately, we can go through your own individual circumstance. So it might be, for example, somebody's working as a support worker, so they might go in an associate member category, but don't worry about that. We can talk about it individually if that's okay. Matilda. So Matilda, having worked as an OT for over 5 years, but worked as a support worker for a charity running therapeutic gardening groups, I use a lot of my OT skills in my role, where I still need to do 60 days or 30 days. So the key to that, Matilda, is to find out, and if you don't know the exact date, is to contact the HCPC registration department to find out exactly when you came off the register. Because the HCPC are working out how long people have been out of practice. It goes from the time they actually came off the register. So you might have been, and I'm sure you have been, using your OT skills subsequent to that. But the important thing is when you came off that register, and whether it was less than 2 years ago where you wouldn't have to do any returning, or if it was between 2 and 5 years, so it's the 30 days, or 5 days more, it's 60. So I'd recommend you contact the HCPC just to check, and then you can contact me and we can go through that together. Okay, and we've got Joanna. So do your normal hours as an OT, healthcare social worker, healthcare support worker, count towards your hours. Yeah, so with the HCPC talk about returning to practice and updating our skills, they don't specify exactly what we would need to do or what experience we need. It's up to the individual returner to decide what would be beneficial for them, what learning would they need to do. So if you regard it, so during your work, if you feel that you are, you know, using occupational therapy related skills, that you are, like I said, you're reflecting, you're discussing with your supervisor, then that can all count, but it's an individual choice. So it might be, for example, if you think about experiences or training, people, you don't have to do like an occupational therapy specific course. For example, you could do something on the Mental Health Act or moving and handling, whatever it is that you feel would help to, that's related to occupational therapy, and you can relate your skills to it, but it doesn't have to have an OT label on it, if that helps. Next one, good question, Sarah. So HCPC, how many hours are in a day? So HCPC, like 7 hours are in a day for returning. Sorry, I'm taking over. Everybody wants to talk. Just tell me to shut up. It's all right. And then the next one, if you're employed as an OT assistant, can you use these hours towards your return to practice if your work are supportive? Yes, and can you claim the hours back? So if you work, there's an occupational therapist who's willing to act as your supervisor and can sign the forms, then you could use that as part of supervised practice, but they would need to agree to that. And like I said about the hours you've done, you can backdate the hours, but the day you send your paperwork in, it all has to be done within the preceding 2 years. So hopefully that makes sense. And if not, please contact me separately. We can go through that. Kirsty, I'm currently working as a band for OT Tech. Workplace are happy to support me with supervised practice. Not sure how it works in practice. How do I do? Okay, how to do 30 days whilst within my band 4 role. So with that, Kirsty, it's to think about your job now, what you're doing. So if you've got, for example, an occupational therapist who you work with, who's happy to be your supervisor, and you want to work in the same team, then you could use the work that you're doing now to be part of that supervised practice. But you need to have the supervisor and discuss with your supervisor to identify what you would need to do. Because again, HCPC leave it very flexible. It's between the returnee and the supervisor, what work they're to do together and what work the returner is to do. So it has to be within the scope of practice of the supervisor. So it's very likely you can use that where you are, Kirsty, but it's good to check, discuss it with the supervisor, and also, like I said, you can discuss it with me. Sarah, do most returners start work at grade 3 or grade 4? So there's no set rules for this. So people can return as a volunteer, they can get job as a support worker, any way you can do it, do it. Basically, some people going in the short-term contract. Sometimes employers have set roles for people to do return to practice. So it can be any grade or in any capacity. It doesn't matter. It doesn't have to be a specific one. This might be a good one for Rachel and Roxanne. So how do you initially plan your focus and study? So how do you kind of get that? How do you start that process, as I say?
Roxanne, do you want me to go first? Yeah, I'll start off. I saw that question, Claire, and I thought that was exactly where I was. And this comes back to what we were saying earlier on about it feeling overwhelming. I think you very quickly work out that there's no singular place you can go to that tells you what you've missed. So I very much started off with a learning plan, just thinking about where do I feel my gaps are. I then, as I say, started looking at the HCPC sites, the Health Education England. I became a career break member at the Royal College of Occupational Therapy, and that really was when it started to escalate in terms of me almost finding it a little bit like, whoa, there's all this information there, but crikey, this is exciting, but a little bit frightening as well. And I literally just, as I say, I came up with a learning plan that I always had kind of like on the table. It was within arm's reach. And as I was reading things and looking, it's literally just morphed every single day in terms of almost discovering something, a document that I wasn't aware of, the AHP leadership strategy. It's literally just being, I had to look at it myself, you know, in terms of being right, rather than look at this and be fearful, I need to look at this and say, right, I'm welcoming what this new knowledge is. And it's literally just been scribbling constantly onto a piece of paper. I need to look at that. I need to look at that. I need to look at that. But just pacing it, and then obviously ticking it off, and then reflecting as well. Because I think the other thing is as well, is that when you're carrying out the private study, I'm finding I'm going away and then I'm thinking about things and I'm reflecting on it, and I'm considering how this new information that I found has changed my knowledge base compared to what it was previously. And then that reflection I'm documenting within my CPD log, and that actually then goes towards my private study as well. So yeah, I hope that answers your question, Claire, but I think the main thing is you've just got to start, because as I say, it's almost like that fear of where do I start with this, that certainly that inhibited me to begin with, and it's just making that jump. Roxanne, I don't know whether you'd add anything different to that.
Yeah, I would agree with that as well. It's that sort of, I think, and I think the big thing, as I say, as you said there, joining RCOT as well. And I think if you're at that point thinking, oh, where do I start? You know, when you join and you get your OT news, because it's very, very small little, articles. It's not so much with the big journals, and just flicking through and finding there may be something in there that just an article that you just think, oh, do you know what? This is quite interesting. And you start reading that, and you look. I would just do it that way, rather than sort of just start and think, right, I've got to look at this and I've got to look at that, and let me start researching. I think that's when it becomes really sort of overwhelming. I think if you just start with, if you haven't started yet, as I said, just start with an article that you find as you're flicking through. Oh, this is interesting. Or if you've gone on the website as well, and you look and you think, oh, I might want to read a little bit about that. And I think start off with small, and then increase it as you start to get more submerged in OT. Then start to then increase it to sort of these longer, lengthy kind of articles that you want to critique. But I would, just so you don't get that feeling of being overwhelmed, start off. That's what I would say. Just to start off with something small that you feel is an interest, and then just sort of progress on with that. If that makes any sense.
That's brilliant. Thank you. Natasha, did you want to say something?
No, I think that it's really helpful to hear how other people have started their journey. And I know one returner said something to me once, which I thought was a really lovely way to think about how to start as well, which was they thought about a patient journey that they'd observed, doing some shadowing, and thought about kind of each steps of that journey and what they weren't perhaps, what it had kind of provoked in them to think, oh, okay, so I need to brush up on that guidance, or maybe I need to look at this new thing that I wasn't aware of. And they use kind of a patient journey to help them to formulate their where do I start. I just also wanted to flag up, I don't know if the person that asked that question is registered on the Health Education England programme or not, but if they are, the National SharePoint platform has a tile entitled Where Do I Start, because it's a very commonly asked question by our returners. So you're certainly not on your own in feeling this way, and hopefully you'll find on there it's got a lot of resources to perhaps think about how you want to start. But the other approaches might be things like looking at your strengths, weaknesses, opportunities and threats through like a SWOT analysis or something as well. So there's a lot of tools on there that you might find thought-provoking or helpful as well. So just wanted to mention that. Thanks, Anne.
Brilliant, thank you. And what we're going to do, because we are overrunning, so I'll give us a few more minutes to go through these questions, okay? But like I said, if anybody's got any follow-up questions, then please email me after this. So Tracy's asked a question about going to private practice and setting up placements. I think, Tracy, that's probably best if we have a conversation about that separately, so I can get all the details from you. So I wouldn't want to give you kind of incorrect advice, but there are people do supervised practice placements with independent occupational therapists. That's another avenue. Naomi qualified in 2000, never practiced an OT. Can I still do the return to practice process? Yes, I can, basically. But again, if you contact me, we can go through that together. Rach has secured a return to practice placement. So she's asking about professional indemnity. So yes, if you joined RCOT as a career break member, then you would have indemnity insurance then for your placements. Sorry, my dog's crying in the background. Okay, so Naomi, I think it's some more information from Naomi. So if she contacts me separately, we can go through that. Yeah, so another one about indemnity insurance replacement. So yes, we've covered that. The last one I'm going to have to do now. So Jennifer's saying, not a question, but something she's found helpful was the courses section in OT News. I've used the courses available to help me structure and focus some of my formal learning, and the costs are claimable if you're in England and registered on the HE Return to Practice programme. Fantastic. Thank you so much, Jennifer. Well, everybody, thank you so much. We've come to the end of the webinar. I'm sorry we've overrun, but I thought it was important to answer those questions. Thank you so much for my colleagues and all the participants. If you've got any follow-up questions or any information, please feel free to contact me. My colleague Hannah will be sending out the slides in a few days. So all I've got left to say is best of luck. Thank you so much for attending, and you're not there on your own. We'll support you with it. Thank you very much. Bye-bye.